Have you ever experienced that moment when you rush to the restroom, only to notice something unusual about your urine? Imagine the sudden worry creeping in as you spot a strange color or odor, leaving you questioning what it could mean for your health. It's unsettling to think that something so simple could be a sign of an underlying issue that might affect your overall well-being. Surprisingly, many people overlook the significance of their urine's appearance and odor. According to the National Kidney Foundation, over 37 million Americans have chronic kidney disease, and many are unaware of their condition. Changes in urine can be early warning signs of various health issues, making it crucial to pay attention to these subtle clues. That's why in today's video, we'll explore 5 critical signs in your urine that you absolutely need to know. We'll break down what different colors, smells, and consistencies might indicate about your health and why it's essential to take these signs seriously. Ready to learn more? Let's get started. Have you ever noticed something unusual in your urine? Share your experiences in the comments below. 1. Dark or cloudy urine, a sign of the body. If you notice dark or cloudy urine, it can be an important sign that something is wrong with your body. Normally, healthy urine is pale yellow, similar to the color of light lemon juice, and clear. This color reflects your body's hydration level. When you're well hydrated, your urine will be light in color. Conversely, dark urine, which is often similar to the color of dark tea or brown, is a sign of dehydration, liver or kidney problems. Dehydration is the most common cause, but the color change can also indicate kidney or liver-related problems. The liver and kidneys play an important role in removing toxins and waste from the blood. If these organs are damaged or not working properly, toxins build up in the body, causing the urine to appear dark. This can be a sign of more serious conditions, such as hepatitis or chronic kidney disease. Understanding this change is essential for early detection of potential health problems. A simple yet extremely effective way to fix dark urine is to drink enough water every day. You should drink at least 8 glasses of water every day to help maintain kidney and liver function, preventing the accumulation of toxins. A small tip to easily apply is to always carry a water bottle with you when traveling, and if you are a forgetful person, you can set a reminder on your phone every hour. This helps you keep a regular drinking rhythm without worrying about missing out. In addition, another way to know if you are drinking enough water is to observe your urine. If the color of your urine is pale yellow or almost transparent, your body is well hydrated. If it is dark, you need to drink more water immediately. Dehydration is a factor that can directly affect kidney and liver health. When the body is dehydrated, the kidneys have to work overtime to try to eliminate toxins and retain as much water as possible. This leads to a buildup of toxins in the body, causing health problems such as kidney disease, hepatitis, and impaired liver function. Additionally, prolonged dehydration can increase the risk of kidney stones, a painful condition that may require surgery to remove. Several studies from the Mayo Clinic have shown that maintaining good hydration levels not only supports kidney health, but also helps reduce the risk of kidney stones and other urinary problems. 2. Foamy urine, abnormal sign. Foamy urine is often a sign of protein in the urine, proteinuria. This indicates that the kidneys are not working properly, as the kidney's job is to filter waste products from the blood without allowing important substances like protein to leak out. When there's protein in the urine, this can be a sign of kidney damage or high blood pressure. This is not always serious if it happens once or occasionally, as urinating forcefully or quickly can also cause foam. However, if your urine is foamy on a regular basis, you should pay attention, as this can be a warning sign of chronic kidney disease or blood pressure problems. Healthy kidneys keep protein in the blood, but when there is a problem, the kidney's filtering membranes become less effective, allowing protein to leak into the urine. This is why foamy urine can be a sign of kidney damage. Proteinuria is one of the main signs that your kidneys are having problems. If left undetected and untreated, it can lead to more serious conditions like chronic kidney failure. As kidney function declines, the body's ability to remove waste products also declines, leading to a buildup of toxins in the blood, which can lead to a number of health complications. Furthermore, if protein leaks into the urine continuously, it can affect blood pressure, leading to high blood pressure and worsening cardiovascular problems. Studies from the National Kidney Foundation have shown that early detection and good control of proteinuria can help reduce the risk of developing kidney failure. One way to support your kidneys and reduce your risk of kidney damage is to eat foods rich in antioxidants. Foods like green tea, strawberries, kale, and nuts are not only good for your overall health, but they can also help improve kidney function. Antioxidants help prevent cell damage, while also helping your kidneys remove waste from your body more efficiently. A good tip to know if your urine foam is normal or abnormal is to see if it lasts. If the foam appears after urinating but quickly disappears, it is usually not a cause for concern. However, if the foam persists and does not dissipate over a long period of time, you should consider getting your kidneys checked. 3. Strong or unusual urine odor. One of the first signs we should pay attention to is when the urine has a strong or strange smell. Most of us often think that the smell of urine is not very important, but in fact this is an important indicator of health status, especially the function of the liver, kidneys, and digestive system. The liver is the organ responsible for filtering and removing harmful substances from the body. When the liver is not working properly, these toxins can remain in the body and even be excreted in the urine. This causes an unusual smell, which can be sweet due to the buildup of ketones, in the case of diabetes, or ammonia if the kidneys are not working well. A study from the Mayo Clinic found that people with diabetes often have unusual smelling urine because the liver cannot process glucose as effectively as it works and breaks it down. Normal urine should not have a strong odor. However, if you notice an unusual smell that lasts for a long time, it could be a sign of a medical condition. For example, in the case of a urinary tract infection, bacteria can change the chemical composition of urine, causing an unpleasant odor. These changes not only change the smell but can also signal diseases such as kidney infections, cystitis, or other serious problems. According to the Cleveland Clinic, urinary tract infections are one of the leading causes of unusual odors. An effective way to prevent this condition is to make sure you urinate regularly, at least 6 to 7 times a day. This not only helps to detoxify but also reduces the risk of bacteria accumulating in the bladder, thereby reducing the risk of urinary tract infections. Another tip is to not hold your urine for too long, as this can put unnecessary pressure on the kidneys and bladder, increasing the risk of urinary tract diseases. 4. Urine is pink or red. One of the more noticeable and serious signs is when your urine is pink or red. This is a sign of hematuria, which is the presence of blood in the urine. This can be a sign of many dangerous diseases, from kidney stones, infections to bladder cancer. Hematuria often occurs when there is damage to some part of the urinary system. Blood in the urine can appear when kidney stones move through the ureter, damaging the ureter and causing bleeding. In addition, infections can also damage the tissues in the bladder or kidney, leading to this phenomenon. In more serious cases, red urine can be a sign of tumors in the bladder or prostate. Experts recommend that if your urine is pink or red for a long time, see a doctor immediately. Hematuria can have many different causes, but one thing is for sure, the presence of blood in the urine is always a sign of a problem that needs to be explored and treated. According to a study by the National Institute of Diabetes and Digestive and Kidney Diseases, kidney stones are one of the most common causes of hematuria, especially in people who are frequently dehydrated or consume too much salt. One important thing you can do to prevent hematuria is to limit your alcohol consumption. Alcohol not only stresses the liver and kidneys, but it also contributes to dehydration, one of the main causes of kidney stones. Another tip is to drink enough water every day, as this helps dilute the minerals in your body, preventing them from accumulating and forming kidney stones. 5. Burning sensation when urinating. As we reach our 50s, maintaining good health becomes more important than ever. One of the easiest ways to keep an eye on your health is by monitoring your urine. There are several warning signs you should be aware of, and one common indicator is a burning sensation when urinating. This burning sensation could be a sign of a number of health issues, most commonly urinary tract infections, UTIs, or urethritis. UTIs are common in both men and women over 50, especially as the immune system weakens or hormone levels change. As we age, our immune system doesn't fight off harmful bacteria as efficiently. For women, the drop in estrogen levels after menopause can also increase the risk of urinary tract problems. A simple way to protect yourself from these issues is by adding vitamin C to your daily diet. Vitamin C not only helps boost the immune system but also acidifies the urine, creating an environment that makes it harder for bacteria to thrive. Fruits rich in vitamin C, like oranges, pineapples, or lemon water, can help prevent urinary tract infections. According to recommendations from the National Institutes of Health, NIH, adults need about 75 to 90 milligrams of vitamin C daily, and this amount can be increased if you're at higher risk of infections. If left untreated, a UTI can spread to the kidneys, leading to more serious health concerns like kidney infection. Kidney infections can cause sepsis and even kidney failure, which is a life-threatening condition. In fact, according to the National Kidney Foundation, NKF, up to 15% of older adults are at risk of kidney failure if they ignore warning signs from their bodies. 6. Little-known tips and information. As we age, particularly for those over 50, paying attention to changes in our urine can reveal a lot about our overall health. Small changes, such as the color, odor, or frequency of urination, can indicate underlying issues like infections, kidney stones, or even more serious conditions related to the liver and kidneys. It's essential to be aware of these signs to maintain a healthy urinary system. One simple yet highly effective way to support your urinary health is by increasing fiber intake in your diet. Most people believe that fiber is only beneficial for digestion, but it also plays a crucial role in helping the liver and kidneys filter out toxins. According to the Academy of Nutrition and Dietetics, adults should aim for about 25 to 30 grams of fiber daily. Fiber binds with toxins in the digestive tract, allowing them to be excreted, thereby reducing the workload on vital organs like the liver and kidneys. In addition to fiber, some natural herbs like corn silk and cranberry are known for their ability to support urinary health. Corn silk acts as a natural diuretic, aiding in the cleansing of the bladder and urinary tract. Meanwhile, cranberry prevents bacteria from adhering to the bladder wall, reducing the risk of urinary tract infections. If you often experience difficulty with urination, drinking unsweetened cranberry juice daily could be a natural way to safeguard your health. Another important factor is reducing your salt intake. Salt can disrupt the body's electrolyte balance and increase the likelihood of kidney stones, placing additional strain on the urinary system. The World Health Organization, WHO, recommends that adults consume less than 5 grams of salt per day to maintain optimal heart and kidney health. Reducing salt not only helps prevent kidney issues but also benefits cardiovascular health by lowering the risk of high blood pressure and stroke. By adopting a healthy diet rich in fiber, utilizing natural herbs, and cutting back on salt, you can maintain a healthy urinary system. It's also important to regularly check your health and be mindful of any changes in your urine, as these can be early warning signs of potential health problems. If you found this video helpful, don't forget to like, share, and subscribe. By doing so, you'll always stay updated on the latest health tips that could truly make a difference in your life. In summary, ignoring these crucial signs in your urine could lead to severe health consequences that might sneak up on you. These simple tips are easy to follow and can prevent you from ending up in situations where even doctors might not be able to help. Don't let small issues escalate into life-threatening conditions. You have two choices: follow the advice in this video and protect your health, or risk facing irreversible problems. The decision is yours, choose wisely. The best part is that the advice given here is incredibly easy to implement in your daily routine. Small changes now can prevent serious health problems down the road, making it worth the minimal effort. Remember, there may not be a second chance to catch these warning signs before it's too late. Acting now means saving yourself from potential pain and suffering. While you wait for more valuable health videos, why not check out these 4 recommendations on your screen right now? They're handpicked just for you.
Thank you for taking the time to enjoy our video, and please be sure to subscribe and share this video to everyone, and don't forget to comment below too.
Warning: foamy urine and 6 warning signs. You have kidney stones. Kidneys recover. Have you noticed foamy urine recently, or perhaps you've experienced sharp, intermittent pains in your lower back or abdomen? These seemingly minor discomforts might make you think it's just a change in my diet or digestion. However, the reality is far more serious than you might imagine. These could be signs of something much more dangerous: kidney stones. Statistics reveal a shocking truth. More than 500,000 Americans visit the emergency room annually due to kidney stone complications, and the numbers are rising every year. Kidney stones are not just painful, they can lead to severe health issues, including kidney damage and even death. According to the National Institute of Diabetes and Digestive and Kidney Diseases, approximately 11% of men and 6% of women in the United States will suffer from kidney stones at some point in their lives. This is a serious health crisis that demands your immediate attention. But don't worry, because this video is your lifeline. We're here to help you identify the warning signs before it's too late. So let's dive right into the first crucial sign you need to watch out for. 1. Pain during sexual intercourse. Pain during sexual intercourse, medically termed dyspareunia, can be a significant and distressing symptom for those with kidney stones. This pain is typically felt as a sharp stabbing sensation or sometimes as a persistent dull ache. The pain can be localized in the lower abdomen, pelvis, or even the back, depending on the stone's position within the urinary tract. The intensity of this pain can vary, often becoming more pronounced during certain movements or pressure applied during intercourse. This pain can be exacerbated by the physical activity involved in sexual intercourse, which increases pressure in the pelvic area and can cause the stone to shift or press against sensitive tissues. Some may experience it consistently during every intimate encounter, while others might notice it intermittently, particularly when the stone is moving or causing significant obstruction. The pain can also vary in severity, sometimes being so intense that it makes sexual activity nearly impossible. It not only causes significant physical discomfort, but also affects emotional and relational well-being. Pain during intercourse can lead to a decrease in libido, anxiety about sexual activity, and strained relationships with partners. The primary reason for pain during sexual intercourse in individuals with kidney stones is the pressure and irritation caused by the stone's presence in the urinary tract. Kidney stones can cause blockages or partial obstructions in the ureter, the narrow tube connecting the kidneys to the bladder. When the stone moves or becomes lodged, it can press against surrounding tissues and nerves, leading to significant pain. During sexual activity, the increased physical movement and pressure can cause the stone to shift or press more forcefully against the ureter's walls or adjacent organs. This movement can intensify pain as the stone scrapes against the ureter's lining, which is lined with sensitive nerve endings. The resulting pain is not only localized but can radiate to other areas, including the lower abdomen, pelvis, and even the back. Additionally, the body's natural response to pain and discomfort can cause muscle tension and spasms in the pelvic region, further exacerbating the pain experienced during intercourse. This tension can lead to a cycle of pain and anxiety where the fear of experiencing pain causes more tension, which in turn increases the pain. The American Urological Association, AUA, also reports that sexual dysfunction can be a significant concern for individuals with kidney stones, further underscoring the need for comprehensive management and treatment of this condition. So, have you ever wondered what could be causing that persistent pain in your lower back or side? 2. Back or side pain. Kidney stones are often characterized by sharp, intense pain in the back or side. This pain is typically felt just below the ribs and can radiate to the lower abdomen and groin. Unlike the dull ache of a muscle strain or the throbbing pain of a back injury, the pain associated with kidney stones is acute and severe, often described by patients as one of the most painful experiences they've endured. This pain can come in waves, fluctuating in intensity as the stone moves through the urinary tract. The onset of this pain is sudden and can be triggered by certain movements or activities, such as bending over or lifting heavy objects. The pain's severity and abruptness often lead to confusion with other conditions like appendicitis or even heart attacks. However, the key differentiator is the pain's pathway, following the ureters from the kidney to the bladder. Statistically, around 1 in 10 people will experience kidney stones in their lifetime, with men being more likely than women to develop them. When the stone is stationary, the pain may subside, but as it travels, the sharp stabbing pain returns, often with increased intensity. The excruciating pain can lead to hospital visits, missed work, and significant disruption to daily life. Many patients report anxiety and fear of recurrence, knowing that kidney stones can reappear at any time. The underlying reason for this intense pain lies in the urinary tract's anatomy. When a stone blocks the flow of urine, it creates pressure within the kidney, leading to swelling and stretching of the surrounding tissues. This pressure activates pain receptors, resulting in the severe pain that is characteristic of kidney stones. So, what could be causing such intense and sudden pain elsewhere in the body? 3. Painful urination. Another silent sign of kidney stones is painful urination, known medically as dysuria. This symptom manifests as a sharp, burning sensation during urination, which can be mistaken for a urinary tract infection, UTI. However, the pain from kidney stones is often more intense and persists even after urination. Unlike the more consistent discomfort of a UTI, painful urination occurs as the stone travels from the bladder through the urethra. The jagged edges of the stone can irritate and scratch the delicate lining of the urinary tract, causing sharp pain and sometimes bleeding. This can result in urine that appears cloudy or has a foul odor, indicating the presence of blood or infection. Research from the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, indicates that about 12% of men and 7% of women will experience kidney stones at some point in their lives. Among these individuals, a significant proportion will report painful urination as a key symptom. This pain can be severe enough to affect daily activities, leading to decreased fluid intake out of fear of urination, which can further complicate the condition. The primary cause of painful urination in kidney stone patients is the physical obstruction and irritation caused by the stone itself. As the stone moves through the urinary tract, it can cause tiny abrasions and inflammation, activating pain receptors and leading to the burning sensation experienced during urination. Moving forward, what other changes in urine might signal the presence of kidney stones? 4. Pink, red, or brown urine. One of the more visually alarming signs of kidney stones is the appearance of pink, red, or brown urine. This change in color is due to the presence of blood, a condition known as hematuria. While it can be quite shocking to see, it's important to understand that this symptom is relatively common among kidney stone sufferers. Hematuria occurs when the stone, with its rough crystalline surface, scrapes against the delicate lining of the urinary tract, causing tiny blood vessels to rupture. The severity of bleeding can vary, with some individuals noticing only a slight pinkish hue, while others may see a more pronounced red or brown color in their urine. The frequency of hematuria episodes can correlate with the stone's movement and size. Smaller stones might cause occasional bleeding, while larger stones can result in more persistent and noticeable changes in urine color. These episodes often coincide with periods of intense pain, particularly when the stone is moving. A study published in the Journal of Urology found that up to 80% of patients with kidney stones experience some degree of hematuria. This high prevalence underscores the importance of recognizing this symptom as a potential indicator of kidney stones, rather than immediately assuming a urinary tract infection or other condition. The underlying reason for blood in the urine is the physical trauma caused by the stone's movement. As it navigates through the urinary tract, it can cause microscopic tears in the mucosal lining, leading to bleeding. Additionally, the stone's presence can trigger inflammatory responses, further exacerbating the bleeding. So then, what could cause urine to change in appearance or odor without visible blood? 5. Cloudy or foul-smelling urine. Another silent sign of kidney stones is the presence of cloudy or foul-smelling urine. This symptom can be particularly indicative of an infection, which can occur when a stone blocks the flow of urine and creates a breeding ground for bacteria. Cloudy urine typically results from an increased presence of white blood cells, which are the body's response to infection or inflammation. When kidney stones cause irritation and injury to the urinary tract, it can lead to an influx of these cells, causing the urine to appear cloudy. Moreover, foul-smelling urine is often a result of bacteria producing waste products as they multiply. The blockage caused by the kidney stone can trap urine in the bladder, providing an ideal environment for bacterial growth. This can lead to a strong, unpleasant odor that is noticeably different from normal urine. The frequency of these symptoms can vary, but they are often associated with other signs of infection, such as fever and chills. Patients may notice these changes more frequently when they are experiencing other symptoms of kidney stones, such as back pain or painful urination. Research from the Mayo Clinic suggests that urinary tract infections occur in up to 8% of patients with kidney stones. This statistic highlights the importance of recognizing these symptoms as potential indicators of both kidney stones and concurrent infections. The primary cause of cloudy or foul-smelling urine in kidney stone patients is the obstruction and subsequent infection caused by the stone. The blockage prevents normal urine flow, leading to stagnation and bacterial overgrowth. Additionally, the inflammation and injury caused by the stone can exacerbate the production of white blood cells and other substances that contribute to the cloudy appearance. But what happens when you experience chills and fever without any apparent reason? This might be another silent but serious sign. 6. Fever and chills. Fever and chills are classic signs of an infection, and when related to kidney stones, they signal a severe condition that requires immediate medical attention. In the context of kidney stones, these symptoms suggest that the stone has caused a blockage, leading to a urinary tract infection or even a kidney infection. Normally, our bodies maintain a stable internal temperature, and any significant deviation often indicates an underlying health issue. Fever is the body's way of fighting off infection, while chills occur as the body attempts to raise its temperature in response to the fever. The frequency of these symptoms can vary. Some patients might experience persistent low-grade fevers, while others might have sudden spikes accompanied by intense chills. These symptoms are particularly concerning because they indicate that the infection might be spreading, posing a risk of sepsis, a life-threatening response to infection. For patients, fever and chills add to the physical discomfort caused by kidney stones and significantly impact their quality of life. These symptoms can cause fatigue, weakness, and general malaise, making it difficult to perform everyday activities. The reason for these symptoms is that kidney stones can cause blockages that prevent the normal flow of urine, creating an environment where bacteria can thrive. As the infection takes hold, the body's immune system responds by raising its temperature to create a less hospitable environment for the bacteria. But what if you suddenly feel nauseous and start vomiting without any clear cause? This could be another crucial sign to watch for. 7. Nausea and vomiting. Nausea and vomiting are less obvious but equally significant symptoms of kidney stones. These symptoms can be particularly distressing because they are often severe and can come on suddenly. Unlike the common nausea that might accompany mild stomach upset, nausea caused by kidney stones is often intense and unrelenting. This pain is often referred from the kidneys to the stomach area, leading to nausea and vomiting. Some patients may experience nausea and vomiting intermittently, especially during severe pain episodes, while others might suffer more consistently. Nausea and vomiting not only cause physical discomfort, but also lead to dehydration and nutritional deficiencies if left untreated. This can weaken the body further, making it harder to cope with the pain and other symptoms of kidney stones. The underlying reason for these symptoms is the body's response to the severe pain caused by kidney stones. The kidneys and gastrointestinal tract share nerve pathways, so intense pain in the kidneys can trigger a response in the stomach, leading to nausea and vomiting. And if you found this video helpful, please like, share, and subscribe to stay updated on essential health tips. We understand that protecting your health can be challenging, so if you're struggling or have valuable insights to share with our community, don't hesitate to leave a comment below. We're here to support you every step of the way. To sum up, ignoring the signs of kidney stones, such as foamy urine, can lead to serious health complications. It's crucial to address these symptoms promptly to avoid painful and potentially dangerous consequences. While you're waiting for our next video, check out the one we've linked on the screen for more tips on safeguarding your health. Stay informed and take care.
Thank you for watching all the end to the video. And if you enjoy my video, please subscribe and share it to everyone. And please drop your comment below